Hi, welcome to High Country Doulas Breastfeeding 101 webinar. My name is Allison Rollins, and I will be sharing with you lots of information for you to help you on your journey for breastfeeding. Thanks for joining us here today. I'm going to be sharing my screen in just a little bit to share with you a PowerPoint. Tell us your name, if you've breastfed before, and share any questions that you might have with us so that we can make sure those get answered. Again, my name is Allison Rollins. I am a doula, a postpartum labor doula. I also support women with breastfeeding. I'm an infant feeding specialist and love to help moms who are trying to breastfeed for the first time or the second time or the third time. There are every baby is different and every journey is different, and we want to make sure that you have the support that you need to make the choices that are right for you when it comes to feeding your baby. So our team of doulas works with moms and partners to help them understand what to expect in those early days of feeding your baby. We also support women who choose not to breastfeed. So if you want to feed your baby formula or a combination of both, we also support you in that journey. So we know lots of information that can be helpful, help you troubleshoot things, and if needed, to get you connected with providers that can support you in answering your questions and helping you troubleshoot any problems that occur. So welcome again. We're going to get started here in just a second. Let me share my screen real quick. All right. All right, let me shift this back. All right, well, welcome. If you've joined us today, we are excited to share with you guys about breastfeeding, and we will be talking about lots of different options for you when it comes to breastfeeding. There's so many different things to consider, and for some moms, breastfeeding comes really easy and is not difficult. And for other moms, there are many challenges along the way. I work with moms who may have to supplement a little bit in the beginning to get baby's weight back up. And I have moms who choose to exclusively pump their milk and feed their baby milk in a bottle. So there's lots of different options when it comes to supplying your baby with food, whether that's breast milk or formula. Today, we're going to mostly focus on breastfeeding and feeding your baby breast milk. We're going to talk a little bit about the culture, the benefits of breastfeeding to both mom and baby, kind of what to expect. We're going to talk about clothing options and feeding in public and what that looks like. We're going to talk about position, different positions that you can feed your baby in. Also, what does a feed look like and timing? We are going to talk about transfer and how to know if your baby's getting enough. We're also going to talk about troubleshooting issues that might arise. We will also cover just talking about feeding your baby with a bottle and what that might look like, and just do a little bit of information on pumping and storage and rewarming. So in today's webinar, we're going to kind of give you a short synopsis of what it looks like to breastfeed. I always tell moms it's so important to actually get more hands-on education with breastfeeding. It helps us be successful if you're able to come to one of our infant feeding classes where we cover not only breastfeeding, but we also cover formula feeding and feeding your baby in all different ways and what that might look like. And that's a more comprehensive class. It's a more thorough class. So this will just kind of get you started, and then we hope you'll join us at one of our infant feeding classes. Sometimes moms choose to begin breastfeeding and then they go back to work and they have that transition. So we do work with a lot of moms who want to learn how to get breastfeeding going, and then also to be able to feed their baby out of a bottle when they go back to work, whether they put breast milk or formula in that bottle. So thanks again for joining us today. My name is Allison Rollins, and let's get started. Right. So to breastfeed or not to breastfeed? Yes. So one thing I want to start with is just understanding what breastfeeding looks like in our country. In the United States, it is recommended that your baby receive breast milk exclusively for the first 6 months, and then to be supplemented with other foods after that, and breastfeed your baby as long as you want to. But if you stop breastfeeding before that first year, you will have to replace your breast milk with formula. After the first year, you can talk to your provider. So this is American Academy of Pediatrics recommendations. In our country, about 82.3% of mothers will start out breastfeeding their baby, but from that 82.3%, only about 50 of those choose to exclusively breastfeed for the first 3 months, and only about 25% through the first 6 months. So thankfully, it's not an all or nothing thing. All right. And this number is significantly higher than it was in the 1970s and 80s. So women are breastfeeding at a higher rate, and it's just an interesting trend to have that happen. So for mothers who can't really breastfeed due to health conditions or medical reasons, formula is a wonderful alternative to breast milk. But from now on, we're going to kind of talk to you more about breastfeeding. So let's take a look at that. So what is the big deal with breast milk, right? Have you ever stopped to think about how amazing it is that babies just know how to feed? Babies have this inborn instinct to be able to breastfeed. And of course, they often rely on guidance to help them get latched. And that is why support is so important for women who want to start to breastfeed. I often work with moms in labor, and getting their baby to feed is very important to them. So I was with a mom once who had to have a cesarean birth. She was trying for a vaginal and ended up having a cesarean birth. And she had, wires hooked up through her IV. She had a blood pressure cuff. She had things on her legs. There's lots of different cords and things that restricted her from being able to move her hands easily and her arms. And so as the labor and delivery nurse was taking care of mom and making sure everything was going well with her medically, I was there to help make sure that mom was able to get her baby latched on. And that was really important to her. So there are many challenges sometimes that women have to overcome to be able to be successful with breastfeeding. You just never know how your birth's going to go. And I think, she just said to me when I was helping her, she's like, I don't know how I could have done this without you. She's like, there's no way I could have managed it. I didn't have the strength or the ability to hold my baby, to get my baby latched on. And so it was really important to her to have that first experience. And she was really grateful to have that support. So it's super, super important to have support when you're trying to get breastfeeding going right off the bat. All right. Hold on one second. There. All right. So another important thing about breast milk is that it has this wonderful nutritious quality of it. It's the perfect food for your baby. So it's sort of a balance of water and proteins, vitamins, fats, Also has carbohydrates, minerals, enzymes, and antibodies. Antibodies is what you often hear about when you talk about those protective qualities that breast milk has. These all are going to help your baby grow and develop optimally. Incredibly, breast milk is sort of constantly changing as your baby changes. So if you have a baby at 35 weeks, you're going to be able to have this perfect milk for your baby as 35 weeks. Ideally, your baby would be born around 40 weeks, but even those premature babies that are born, they have the perfect milk for them. Oftentimes in the NICU, they ask that moms pump their milk so that babies can get that wonderful milk to help them grow and to thrive. It's just fascinating. All right. So breast milk and digestion. Babies' digestive systems really aren't fully developed, like a lot of other things with babies, until they're around 6 months of age. And their gastrointestinal tract starts to produce more digestive enzymes necessary to break down foods. Having breast milk up to this stage is important, as breast milk contains enzymes, amylase and lipase, okay? And they aid in the digestion while their bodies are developing. Formula is the best option when breast milk isn't available, but the proteins found in formula sometimes tend to be harder curds than the proteins in breast milk, which sometimes affects digestion after eating. Breastfed babies will digest and feed in 1 to 2 hours versus 3 to 4 hours it takes for a formula-fed baby. Additionally, breast milk is designed to allow your baby to be able to absorb all of those necessary proteins in their system. It's assimilated from the mouth down. It's pretty phenomenal. Breast milk and allergies. You may have heard this from your friends. Oh, I breastfed my babies, so they didn't have allergies. So breast milk is not going to prevent your child from getting allergies if they have a genetic inclination, but it might impact their ability to have less allergies than they would have without it. But breast milk does protect against things like eczema, food allergies, asthma, respiratory allergies by reducing those risks and minimizing the severity of when they do occur. This is really possible because the proteins and those antibodies that we talked about before in breast milk help to build this sort of layer protection in their intestinal tract. Without this added layer protection, inflammation in the walls of the intestines can allow undigested proteins to cross through that gut, causing an allergic reaction and other health problems. And this is not to say that a child not breastfed will develop allergies with certainty, but it is nice to know that our bodies can help minimize the risk of your babies to developing an allergy. Right, so breast milk and infection. I have moms all the time ask me, like, can I breastfeed when I'm sick? Yes, you can breastfeed when you're sick. And in that breastfeeding, when you're sick, you're also going to be delivering lots of wonderful antibodies against whatever you have. So if you get the flu, if you get a cold, you will have antibodies that will come through your milk to help protect your baby from getting that same illness that you have. So it offers tons of immunities. In fact, between 40 to 80% of the cells in breast milk are microphages. I'm probably mispronouncing that, but bacteria, fungi, and virus-killing cells. So amazing, incredible live stuff. Helps to make breast milk sort of an immunological, antimicrobial, and anti-inflammatory powerhouse when it comes to protecting your baby. In my family, when I had a baby who was being fed breast milk, oftentimes everybody else in the family would get sick, but that breastfed baby would not get sick, which was amazing and really helpful. When you're taking care of 6 people in your family, to have one more on top of that is often just over the top. So breastfed babies also experience lower rates of respiratory and gastrointestinal illness, as well as urinary tract and ear infections. So it also has been shown to decrease the severity of diarrhea if that's an illness that your baby runs into. We know that if we have older children, they bring home all kinds of lovely germs to share with us. And oftentimes babies, if they do get sick, they tend to not get as sick. So let's talk about the benefits of breastfeeding for moms. So you're important too, and breastfeeding benefits you just the same way as it, in many ways, just like it benefits your baby. It does help many moms be able to recover quicker from birth by releasing the oxytocin hormone when you are breastfeeding. That will help to your uterus to clamp down and contract, and to slow that bleeding that's happening in that postpartum. Studies have also shown that breastfeeding does also reduce the rates of breast cancer, ovarian, diabetes, arthritis, heart disease, high blood pressure, and high cholesterol for moms. Exclusive breastfeeding can also delay the return of a menstrual period, which could encourage healthier spacing of your pregnancies, but should not be used as a form of protection against getting pregnant. So I always tell moms, I'm like, you can actually ovulate without having a cycle, which can be a little confusing for women who are used to having a cycle and then knowing kind of when they're fertile. So we always recommend talking to your provider about your options with that if you're not ready to have another child. Breastfeeding can help you return to your pre-pregnancy weight due to higher number of calories required. Oftentimes moms will find that that weight will kind of slowly start to be reduced, usually like 3, 6, 9 months for some moms. There are a few moms out there that tend to hold on to their weight until they finish breastfeeding, but for the most part, most women don't. The hormone prolactin, which is released during feedings, also promotes relaxation, which is a great for sleep for moms who aren't getting as much sleep. So it's easier to take those naps. So breastfeeding is kind of this emotionally fulfilling experience often for moms. Many women feel very connected and have this bonding experience. Babies kind of leave our womb, and then we have this really physical closeness. It promotes a sense of security both to moms and to babies to feed your baby from your breast. We talked a little bit about those hormones releasing that will promote your nurturing behaviors and which really calm both mom and baby and can have a wonderful effect on the whole family. This bond that you develop with your baby is really important as you continue to parent that baby who grows into your big child one day. And just to note that, but if you aren't able to breastfeed, you can still create that bond with your baby by connecting, having skin to skin, snuggles, cuddles, lots of ways to promote bonding. So one of the things people always ask is like, what should I expect with breastfeeding? When I was first pregnant with my baby, I had attended a Latch meeting, and it was really helpful for me because I hadn't been around a lot of people who had breastfed. I didn't know what it looked like, how it worked, what that would look like when I was out with my baby in public, those kind of things. So that was one really great insight that helped me. So if you have access to a friend who's breastfeeding, or have a La Leche League meeting or a mom's group that's meeting near you, sometimes that's a great way to kind of learn what to expect. But from here, I'll just say that in those first few days of breastfeeding, your breasts are kind of producing this special kind of milk called colostrum. It's often called liquid gold. It's very sticky and it comes in small quantities. This is sort of a thicker, richer milk, and it is full of great things for your baby. It's got vitamins and proteins and antibodies and those anti-viral agents. I always think of it as kind of this coating lining. It coats that the first thing to go into your baby's gut after they're born. And then it also helps baby to be able to have their first bowel movement. So it's got that nice laxative effects. Some people say it's like your baby's first inoculations. So it's really nice to be able to feed your baby. But one thing to note is that when you're feeding your baby in those early days, before your milk transitions over to your mature milk, we have to think about it as teaspoons of quantities instead of like ounces or milliliters like sometimes we think about. So it's really small but really powerful. In the first few days, your baby will be feeding anytime they feel hungry. So part of those first couple of days is this practice. So baby has that innate instinct, but you're going to be just practicing with that baby. So as often as baby is willing, around every 2 to 3 hours, you're going to be offering, providing baby a chance to breastfeed. It's easier to kind of, when you're in the hospital and they have that support, to make that happen. If you have some great supportive labor and delivery nurses who help you, always ask your nurse if there is a lactation consultant on staff. So while you're in the hospital, you can have at least one meeting with a lactation consultant just to be able to ask her all those questions that you might have now that you're actually breastfeeding. Moms have tons and tons of questions, so do partners. So a great time to ask for that. I often tell moms, I'm like, if you are having trouble, any trouble, when you're in the hospital breastfeeding and you have somebody who supports you, but it still doesn't help you, that's a great time to just, for dads or partners to be like, we need somebody else. Can you find somebody else to come in and help us? So don't be scared to ask for what you need. Those first couple of days are so important. I one time was going into the hospital for a postpartum visit for a mom, and she said, oh, it's been 6 hours since I fed my baby. And I was like, 6 hours? And this was during the day, not the night. So I said, okay, maybe there was a lot of shift changes over there. Let's get over here and try to get your baby latched on. So 6 hours is too long to go without feeding your baby. And sometimes it does happen, but just know that you can ask for that, hit that nurse call button and ask for some support if you're not able to get baby latched on your own. All right, so let's talk a little bit about what to wear. Lots of different options out there. Oh my goodness, since I breastfed, so many cool options. Ours were kind of like not so savvy and stylish. So nursing bras, nursing tank tops, dresses, lots of loose fitting clothing. One of the things that I see that a lot of moms really like, and especially if it's winter, are the kind of tankini nursing tanks that unclip and pull down, but you still have like something covering your stomach, which is really nice. So those are a great option. You can use those with a nursing shawl if you feel more comfortable. They've got some really stylish nursing shawls and covers that also can be used to cover your infant car seat. Very versatile, love it. Nursing bras can, some nursing bras can be not fit right and can actually cause you to have plugged ducts and different things. So you really want to have a good fitting nursing bra. It is super important to have it. And if you have any questions about those, definitely check in. You can email us and we can give you some tips on that. All right. So another thing we get asked a lot when working with moms is trying to be able to go out in public and breastfeed their baby. A lot of first-time moms especially feel very private and shy about this. And so I always tell women, I'm like, practice at home, practice in front of a mirror. If you want to wear a nursing cover, practice with your baby with that. So when you do have to go out and feed your baby and your baby's starving, just note that babies have to be fed. And a lot of times you can understand a little bit more by looking in a mirror. Having your partner or your friend sit across from you, you really don't show a lot as you think that you do. So as we get more comfortable with breastfeeding, we're able to do it very easily without having to flash the world. So lots of different things to consider in that, but there's lots of really great tools out there to help you with that. And there's more and more spaces being available for that. But like I said, they're not everywhere is optimal for you to feed your baby, but sometimes your baby just needs to be fed. And it feels so much more comfortable when you're prepared for that. All right. So another thing to note too is that a lot of women have leaky breast, and they may let down on the other side while they're nursing on one. And a lot of women need to wear nursing pads so that that leak won't be absorbed and through your shirt. Another tip is to wear pattern shirts rather than a solid, because if it does leak a little bit, it kind of doesn't show up as much, which is great. Oops. Sorry about that. Oh my goodness. I apologize. Back to presenting. My notifications were on. All right. You can also pump your breast milk and give your baby breast milk in a bottle if you feel more comfortable in that. So there's lots of options to help you managing being able to feed your baby in different locations. All right. Let's talk about getting your baby to latch on. So I work with moms in those early days and weeks to help them, support them in getting their baby latched on. And sometimes babies are just these wonderful innate latchers, and they just get on there and they're like Hoover vacuums. And sometimes they're kind of a little shy and a little slow and a little sleepy. And those babies are a little bit more challenging, but with encouragement and support, we can get your baby latched on to breastfeed. So a couple of things to note. Holding your baby really close to your body. Babies are tummy feeders, just like puppies and kittens. So they feel most comfortable and most able to focus on the latch when their stomach and chest is very close, skin to skin up against your body. So much easier to get them latch. Also supporting your baby's neck, shoulders with your hand, but allowing your baby's head to move freely so that your baby can lift their head and find your nipple. So you want to bring your baby to your breast and not your breast to your baby. You can brush your baby's mouth with the underside of your areola, which will usually cause them to open their mouth really wide, often like a baby bird, I always say. And then you are going to pull your baby towards you up and over your areola and get them latched on with a really nice wide latch. It's sort of this synchronous thing, but definitely having support there to help you when you're doing that for the first time is super important. Baby's chin will be kind of hitting first, and then baby's mouth will kind of come up and over, I call it the mountain, up and over the mountain. They're going to kind of be tucked in, reach up and over the mountain. They can do this in lots of different positions. I love laid back nursing as the first position to get baby latched on, because baby feels very secure with that tummy laying up over your chest. But lots of other options too. The ways that you can tell your baby is latched well: your baby's chin will be tucked into your breast with their mouth open wide and the bottom lip curled back or splayed. Their nose will be clear or only just touching your breast. Most of your areola, now there's lots of different sizes of areolas, ladies. Some women have bigger ones than others. But Most of the areola will be visible above your baby's lip rather than below it. So your baby's lower lip will be mostly covering that part of the areola, but their upper lip, you're going to see the part that is below their lower lip, or beyond their their upper lip, excuse me. And there should be no nipple pain during feeding. Now, I won't say no nipple pain. Just the fact of a vacuum, like suction on your breast, is going to have a sensation, and it might have kind of a painful sensation. Some women describe it as very pulley, kind of just like strong, intense, but it shouldn't be like toe curling, pinchy pain. So that's a real difference there. So it's really good to have to kind of start again if you're feeling toe curling, pinching pain. This baby probably doesn't have a nice deep latch. Their nipple, or your nipple, is probably not getting deep enough into their mouth. As I said before, it's so key in having somebody there to help you. So lots of different positions with baby. There are my favorite, the cross cradle hold. The position here on this is showing the cradle hold. Now, cradle hold is really usually kind of challenging for newborns. I don't find moms can really control baby's head and neck really well, unless they're experienced nursing moms. So the cross cradle hold is a great one for first-time moms, but the cradle hold is something that you will get to be able to utilize too. So in the cradle hold, your baby's head is going to be in the crook of your arm, and your hand will be on their back. And you can use your opposite arm to support your breast if you need to get baby latched on. The cross cradle is when you're using one arm to support baby's head and neck, ideally having your thumb and index finger behind their ears, and your palm of your hand will be on their upper back. When you do this, oftentimes their bottom is in kind of the in your elbow, so you're kind of holding them that way. And then your opposite hand will be supporting and helping baby get latched on with your breast. That's a really great hold for newborns. The football hold is also a great option. This option is really great for moms who have a cesarean section, who have don't want to put baby near their incision site. So the football hold, you're going to tuck your baby under your arm. Same hold as you would for the cross cradle, where your thumb and your index finger is going to be behind baby's ear, and the palm of your hand will be on the top of their back, and their bottom will kind of be resting in your elbow. But you're going to have them kind of tucked in like you would, like a person who would be carrying a football down the field. It's kind of tucked up under there. In this position, I like to tell moms that if you can turn your baby so that their tummy is up against the side of your body, that will help support that tummy feeding. So babies tend to latch a lot better when their tummy is pressed, like pushed against it, and feeling really cozy. Same reason they love swaddling. So that in that position, baby's going to be coming up and around your breast, so their nose will be kind of pointing into the middle of your chest in that position. Reclined or laid back nursing position is a really good position for first couple feedings when mom's in the hospital bed, and she can really get lots of rest and not have to sit up for that. And baby is going to have their lower feet kind of at one of your hips, and then they'll be laid across your body, and then they kind of lift that head up and be able to come up and over your breast to feed. Now, we all have different size areolas, like I said before. We also have different size breast, and what works well for one mom is not going to work well for another mom. So when you have that support of your doula or your nurse to help guide you and making the best choices with that, it's super, super helpful. This is one of the number one questions that I get when I'm helping a mom with breastfeeding. How do I know if baby is getting enough? It's such a common question, right? You will know if your baby is getting enough breast milk if your baby is feeding at least um, 10 to 12 times a day in the beginning, and that includes during the night. So that's in a 24-hour period. Needing at least 5 diaper changes for disposable diapers or 6 to 8 for cloth, and has 2 or more soft runny bowel movements per day for around the first 6 weeks of life. Now, in the first 1 to 3 days, sometimes 4 days, if your milk's a little later to coming in, 1 wet diaper for day 1, 1 poopy. 2 wet diapers for day 2, 2 poopy. 3 wet, 2 poopies. So there's, as long as your baby is getting some in those first couple of days before your milk switches over to mature milk and comes in, that is adequate. So you should be, the insights that I'm telling you here are after your mature milk has come in. Baby is also gaining weight and growing well, being active and alert and not super, super fussy or cranky. You will typically go and see your pediatrician or baby's doctor in the first 24 hours after being released from the hospital. It's always a good way to get that weight check, see how baby's doing. Oftentimes your baby's doctor is also going to have some lactation support in their office, or at least someone who knows a good bit about breastfeeding. So it's a great place to get some support and ask for it while you're in there. All right. Your baby will let you know when they are done feeding. Oftentimes I say that babies are kind of like this little crunchy ball when they're like tight ball when they're hungry. They just get their fist right up by their bodies and they're, so oftentimes a full baby is going to kind of have a floppiness to them. They're going to floppy, like as in full and relaxed and content. They'll have like milk dribbles coming out of their side of their mouth, and they'll just be really content and calm in sort of a deep sleep. All right. Nighttime feeding. So nighttime is the most difficult time, I think, for moms. We're more tired, exhausted. If you're still working on getting your latch and feedings down, it can be super challenging. Oftentimes partners don't wake up, and so we tend to be like, oh, I don't want to wake them. But if you need support, definitely wake up your partner to get some support with that, at least to be able to get like a nice glass of water so that you're not dehydrated at night, and just have that little cheerleader with you. So babies are kind of up at night. Sometimes they are crying, sometimes they're hungry, sometimes we're sleepy and we don't wake up until they're just starving. So that is sometimes hard to get a baby to feed when they're past that hunger cue. So they're beyond hungry and they're screaming. Sometimes dads can be great to help moms at this time, to take the baby away, settle baby down, and then start again. It is super important to kind of learn baby's hunger cues and know a little bit more about us. We share that in our infant feeding class so that you can stay on top of your baby's need to feed and limit those severe crying episodes. Keeping your baby close. So American Academy of Pediatrics recommends rooming in with your baby for the first, at least for the first 6 months and up to a year too. So baby's going to be in a bassinet nearby. You're going to be able to hear your baby. Keeping the lights low. So you want to be conducive of baby understanding that nighttime is sleep time, quiet time. Turn on as little lighting as you need to be able to get baby latched. Also consider purchasing a wonderful new pair of pajamas that helps you, support you in your breastfeeding experience, and you can wear and feel special that you've got these wonderful new pajamas because you're working hard breastfeeding your baby. And just be ready. So have a nice, wonderful little basket that has everything that you need in it, your diapers, your spit up towel, anything else that you need to nurse your baby close at hand. Not having to leave the room is super key because it will disrupt your sleep less and will disrupt baby sleep less. So if you don't have a changing table in your room, the ones that come in your diaper bags are great to be able to lay out on the bed to have a protectant and just change baby's diaper right close next to you so that you're not getting up and disrupting your nighttime too. And just enjoy these moments. It goes by really fast. It's hard to enjoy it, but so many moms will say, oh gosh, I miss those times when I was breastfeeding my little baby, because it does go by. So let's talk a little bit about issues that come up with breastfeeding. It's a beautiful thing, but unfortunately sometimes problems arise, and when they do, it is good to know what kind of things you and others may experience to help you stay calm, help you know how to seek help. I work with moms who are having breastfeeding issues all the time, and if they are beyond my scope, I definitely send them to a wonderful lactation consultant who can help them with those further. And those are great ladies that work in that. So let's look at a couple of the common ones. So my baby falls asleep while nursing. The best way to make sure your baby is not falling asleep before getting enough milk is to fill that sleepy mouth with milk and gently do breast compressions with your hand. So we talk about this and teach this in our infant feeding class, but breast compressions can be really key for newborns who are not really good and efficient at getting milk out of the breast before they just kind of nod off to sleep. Also, latching on hurts. It is sometimes common to feel sensitivity, like I said, but breastfeeding shouldn't be extremely painful. And this is a sign that your baby does not have enough of the breast tissue in their mouth typically, or has some kind of anatomical issues going on. You want to stick your pinky finger in the corner of their mouth and break that suction and try again. Like I said, many moms have found that when they get a baby tight into their breast, like this baby is not in this picture, so tucking that baby really tight into their breast and then having them come kind of be in the middle of the breast and then come up and over really is a great way to get baby on in a good latch. Sometimes moms say that their breast doesn't feel full. So some women start to worry about this at about 6 to 10 weeks when their breasts stop feeling that heaviness as they did in the beginning. And this is really actually quite normal. It is a sign that your body is adjusting to the actual feedings that your baby needs. So you've kind of regulated that production down and you're not overfilling your breast in between feedings. So that's a really good sign. Let's look at some special issues that may arise and deserve a call to your doula or infant feeding specialist or a lactation consultant. All right, look at this sweet baby. Lots of hair. So a couple of issues that you hopefully won't encounter, but are really good for you to be aware of is are things like a burning sensation. So if you experience nipple pain between feeding accompanied by shooting pains in your breast, this may be a sign of thrush, which is an infection caused by a yeast pathogens called Candida albicans. Not a fun thing to experience. So if you have any of these sensations, definitely call your doula, your lactation consultant right away. Cracked nipples. This is a definite sign that your baby's not getting a good latch. And it can also mean that there could be an infection. So when you have a cracked nipple, you want to reach out for help, call your doula, call your lactation consultant so that you can get that taken care of. Another one is a painful red spot. A painful red spot on your breast could be a sign of mastitis or a clogged duct. And I would go even further to say this is a wonderful time for you to start really having great breast awareness. We talk about this in our infant feeding class to be able to get ahead of any plug ducts or mastitis that might be coming on. So come and share with us in our infant feeding class. We love to talk about that. All right. So get asked this question too. How long should you breastfeed for? So we talk about numbers of times in a 24-hour period, but how long should you breastfeed? That is a very hard question to answer in detail, but some babies are going to be Hoover vacuums. Some babies are going to be those little nip and nap and just kind of like, this is kind of good, but I'm kind of tired. And they're not super excited about getting on there and getting their milk and getting done. So typically babies is recommended that babies, a good feeding is over 5 minutes. So ideally, if we would like be able to control babies, which we're not, of course, or there are children or humans in general on that spectrum, we'd be like 20 minutes on one side, 10 to 15 on the other, and then start again and start on the side that you finished on the last time. So when we talk about that length of time, we talk a lot more in depth about that in our infant feeding class. Also, people ask how long, how many months or years should I breastfeed? So one thing to understand is that if you breastfeed for at least 6 months, then you will be starting introducing solids in there, and you're more likely not to have to supplement with formula because you can still breastfeed and have solids in there. And always talk to your baby's provider about what's the right choice for you. Typically, babies who are able to sit up and have that nice suck swallow can start solids around the middle of first year. So at 3 to 4 months, your baby is sort of developing and growing immensely during this time, and exclusive breastfeeding during this stage is advised because it helps that digestive tract that's still trying to mature and providing those enzymes. And then once they get to the middle of the first year, your baby's going to be starting solids. And this may not necessarily replace a lot of your feedings, but it's going to be supplement too. And baby's just kind of experiencing and tasting and exploring other foods. At 9 months, this will help ensure better performance through your child's life. And at 12 months, if you choose to wean your baby off the breast at this time, you will not have to supplement with formula. And your provider will talk to you about what other types of milk or food that your baby should be consuming. If it's kind of, I always say it's up to mom and baby. So as long as mom and baby are happy in that, and it has to be both. So if mom's not really happy and baby's still nursing, mom can limit wean or partially wean down to something that is more comfortable for her. And then sometimes babies will wean before moms are ready to wean. So both of those things do happen. Let's talk a little bit about feeding your baby with a bottle. So a lot of moms have to go back to work. They're going to be away from baby. So how can I feed my baby if I'm away? You can see this mom is holding her baby, or this person is holding a baby. You see how the milk in that bottle is kind of horizontal. So if we feed our baby in this position, they're going to be able to control the flow of that milk as it comes to them. They don't have to keep swallowing because milk is dripping out, because it is not in an upright position or a position where gravity is drawing the milk out. You really want to hold your baby in an upright position. This type of feeding is called pace feeding, and it is a more natural flow for your baby. Babies tend to have a better feeding understanding of the fullness that they have when they feed with pace feeding versus the bottle being upright and dripping into their mouth. It is really helpful for babies to also be able to burp when they're bottle fed, because they do draw a little bit more air. So burping several times during a feeding is always a good idea. And bottle feeding is really important for us to not look at it as a negative when it comes to parenting. It is really often necessary, and as long as you want to maintain your breastfeeding relationship, if you pump your breast to replace that feeding, you shouldn't have to worry about any changes in your milk production. We do talk a lot about that in our infant feeding class. So if you are wanting to pump your milk for your baby, how do you do that? There is a great website called Aeroflow that gives you lots of options for what types of pumps are out there. Pumps usually come from anything from a manual pump or a hand pump to a double electric to a hospital grade electric. And so depending on your situation and your supply, if you're feeding one baby or two, how often you're having to pump your breast, your work situation, there's lots of different options there. Some come with battery operated options. So if you don't have access to plugs, there's lots of great ones out there, and it's good to talk to other moms about this, or talk to your doula or your lactation consultant when trying to choose the right breast pump that works for you. Okay. When it comes to storing your milk, there's a couple of options. So there are hard BPA plastic containers. They're typically sold along with breast pumps. There are also breast milk freezer bags. A lot of the companies make breast milk freezer bags, and then glass with a leak-proof lid for your refrigerator. In anything, you want to know that breast milk, if frozen, is going to expand. So do not overfill your containers. How much do you need to store for your baby? So if your baby is 1 to 2 weeks old, about 2 to 3 ounces per feeding. For babies that are like 2 to 6 months old, about 3 to 5 ounces per feeding. How long do you store it? If you will be using the milk within 5 days, you can store it in the refrigerator, but otherwise store it in the coldest part of the freezer for up to 4 to 6 months. If you have a deep freezer, it can store longer, like a deep freezer separate from your refrigerator. Those will keep your milk fresh up to like 12 months even. Freshly pumped milk can be stored in a cooler. So if you're away from a refrigerator, it can be stored in a cooler with ice packs for up to 24 hours. If you follow the time frame in the breast milk storage guidelines that I'm going to send to you in an email, you can keep your milk room temperature, then refrigerate it, and then freeze it. I always tell moms that they're keeping 1 ounce to 2 ounce of storing, especially frozen milk, is really good, because once you thaw frozen milk, you can't refreeze it. And sometimes you can add those together, but you can never, what are you going to do if you thaw 4 ounces and baby only eats 1? You can always rethaw another ounce, but it's hard you can't go backwards. All right, let's talk about rewarming your breast milk. So if you have to store your excess breast milk by refrigerating or freezing it, it is important to follow safety when reheating it to maintain the nutritional integrity of the breast milk. So you can use warm water. You fill a bowl with warm water and place your airtight storage bag or bottle into the bowl and cover it with a towel to hold in the warmth. You gently swirl the milk in the container. Don't shake it before testing it, and to make sure that it is heated through. And it is recommended that reheated milk be used within 15 minutes to avoid bacterial development. That is on the conservative side. So steaming. You can also fill a saucepan with water, heat it on the stove, and then place a metal cooling rack on top of the saucepan. Wear an oven mitt and place your sealed bottle or bag on the rack after making sure. So you want to do this on a low steam, or even boil it and then take it off of the burner so that you're not actually heating it. Bottle warmers are a great option if you're going to be warming breast milk or formula a lot. They're a nice gadget and they have the more hands-off approach. We do never really want to encourage microwaving or cooking your breast milk. It is going to reduce the antibodies and the great qualities in your breast milk. So remember that anybody who takes care of your baby, make sure they know that. Well, it has been so much fun to kind of hang out with you guys today. I know that your journeys are going to be wonderful. You guys can reach out to us if you have any trouble. We know lots of wonderful doulas in your area that can come to your home and support you. We also know some wonderful lactation consultants if you need that support as well. So thanks so much for listening to our Breastfeeding 101 webinar today. Again, I'm Allison Rollins with High Country Doulas, and I love supporting moms in those early days with their baby. We hope that this experience left you with some good information to get you started. We do have a wonderful infant feeding class that's a 3-hour long. We cover breastfeeding, bottle feeding, pumping, lots of different details, and send you off with lots of great information in our packet. So if you're able, definitely, we have a couple of those coming up. Check out our website for those coming up on the 12th of next month in Johnson City and the 9th of November in Boone. So we do have some wonderful webinars as well coming up and a couple of workshops. So check out our events page on our High Country Doulas website so that you will be sure to not miss any of those great educational opportunities. I'm going to stop recording and then we can take any questions that you might have. Thanks so much for joining us here today. All right, and I will send a couple, an email out with some further reading that you all, if you're interested in. So. I hope everybody has enjoyed today's webinar, and I hope that you guys will check out our YouTube channel for other wonderful webinars that we have recorded there that might interest you.